Alrighty, so welcome everyone to our informational meeting. I wanted to begin by just telling everyone thank you for taking the time. I know it's after hours from everyone's busy schedule, family life to join us and hear a little bit more about what we do and what we're all about. And then just as a quick heads up, the meeting is being recorded. We did have some members that were requesting copies of the recording. So if anybody else would like a copy after to share with colleagues or anybody else, just feel free to reach out to me and I'd be happy to send that over. So kind of what we're going to go through today we're going to have a brief background of Nobility Health and our experience in the past, as well as our role in the space, in the healthcare space at this time, because God knows it's changed a lot in 2020. I'll then pass it along to Cody from Abbott, who will introduce BinaxNOW and the Navica app that he mentioned. And then we'll go on to discuss how we will use those resources to bring testing to you and your organizations. We do have kind of a wide variety of representation, as you saw, from different schools and education levels, different organizations. So I'll try to be as high level and general as possible. And once we get to the end, there will be plenty of time for questions. We can get into more specifics. I'll also share my contact information in case any questions come up later. So just a little bit about Nobility Health. We are a healthcare management organization. We're based in Los Angeles. Our specialty has been primarily ambulatory care. We manage outpatient surgery centers, ambulatory care clinics, and physician satellite offices for over 7 years. Our top priority has always been to deliver high quality patient-centered care to the communities that we serve. In light of the COVID-19 pandemic, we began creating COVID-19 testing sites with the goal of providing easy and efficient testing to all the communities that we've had the privilege of working in. Through each phase of the pandemic, as the virus evolved, the positivity rates evolved, we and our team of innovative healthcare workers have through the leadership of Dr. Howard Kaufman and Dr. John Kowalczyk, updated our protocols and really streamlined the process. So we had quite a bit of trial and error to get to this point that we're at right now. And our pop-up testing sites helped us discover different ways that we can set up shop in different areas, from parking lots to community centers to actual testing laboratories and locations. So just a little bit about the areas that we serve. We're in Glendale, South LA, Studio City, Silver Lake, and Santa Monica. We've provided testing to the entertainment industry, production companies, educators, small businesses, as well as a number of restaurants. And then just a little bit about our experience with Abbott Binax. As I mentioned, we've been doing this for a little bit, and we've worked with different companies and different test kits. The most important thing about the Binax kits are that they are comfortable compared to the different antigen tests we've used. This is a mid-nasal swab. It's not nasopharyngeal if we have smaller children that we need to test, or even older ones, because God knows that's not comfortable. It doesn't go all the way to your brain. This is good not only because it's more comfortable in the moment, but it prevents testers fatigue. If we're going to get our athletes back on the court, we're going to be back in rec centers, indoor spaces. This is probably something they're going to have to do more than once. So they won't get sick of it because it's really not that bad compared to other tests. Just another technical point, Cody will go into greater detail on this, but the test is more specific than that of competitors when it comes to antigen testing. And the combination of Abbott, BinaxNOW, and the Navica app creates real ease of access to the results of the test. So we've also been through numerous lab softwares and different mobile apps and different ways to text results, email results, and really this is the most incredible one we've seen. It's the easiest one to deal with. So I will go ahead and pass it on to Cody at this time, and he will go into greater detail about BinaxNOW as well as the Navica app.
Yes, thank you. That was an amazing introduction into Nobility Health and a little bit more about the BinaxNOW and Navica app. So I'm going to quickly pull the reins here and go through some of the slides that I typically will present for schools, knowing that with the different populations that we have here, understand that there is a lot of flexibility in utilizing Nobility Health to assist and oversee the testing at your local schools. So when I go through here, I just want to present the ability for the utilization of the Navica app can be segmented into each of those different schools. They will be able to, our Nobility Health will be able to oversee the testing there. And as I get into the specific apps, just understand that each of your schools can have your own portal, which means that you have the results to your specific school, as to opposed to having a blend of every single entity that we're going to be conducting, or the Nobility Health is going to be assisting with multiple groups. Your particular portal is just going to be your students. I'm going to speak in that type of presentation to be able to go through this. So if that question does arise, I just kind of wanted to let you know that each particular school will have their own Connect portal, which means that you're going to have your own access to your Navica specific qualifications. Okay. So I'm going to quickly right now go ahead and share my screen. And then you guys are quiet. All right, which screen am I sharing? This one. All right. And I need to switch. There we go. Okay. So Navica and BinaxNOW. These two tests were, or this particular test was designed to be able to assist antigen testing to the market. We coupled that with a technology that would allow entities to have clear access to and visibility into the test and results, and being able to push those results to the patients themselves. When we talk about schools, understanding that part of the information being shared to the schools or to the patients themselves can be done in multiple different ways. And so I'm going to quickly go through a little bit more about the BinaxNOW, although Sophia did an amazing job of presenting the ability of utilizing this particular test in many different facets. The use of the BinaxNOW, because it does not require an instrument, means that it's a decentralized type of testing platform. Specifically notated here in the middle of our screen, you'll see that there is the BinaxNOW card. It's about the size of a credit card, and so it's a very small test, but it's also one of the most accurate tests on the market. Our president and chief executive officer Robert Ford, his initial behind the BinaxNOW and the Navica app is so that you're able to offer a comprehensive testing solution to those specific entities that need to get results quickly, and to have the confidence to go about their lives in a healthy manner, and be able to have that information be able to be scalable, as well as utilizing that digital health tool of which many entities are utilizing. Here's a little bit of information about the BinaxNOW antigen test card. One of the key things I want to focus in on is that sensitivity at 95.6 and our negativity specificity within 98.5. It ultimately is one of the best and most accurate antigen tests on the market, specifically as an antigen test. When we look at the overall testing structure, I want to be able to share this with you guys so that you be able to have a better understanding of how the test is going to be utilized within Nobility Health. Understanding that Nobility Health is going to be conducting the test and overseeing these tests, but the transparency of how they're going to be able to operate this does bring to light a lot of questions that many schools have to play. So let's say that a particular individual is going to get a test from Nobility Health. What they're specifically going to be doing as far as the Nobility Health is they're going to open up a brand new card. They're going to add 6 drops of reagent into that card, and then they're going to collect that patient sample from the individual. As Sophia mentioned, it is a front to mid turbine sample collection, which does reduce tester fatigue. They're then at that point going to insert the swab into the card, rotate clockwise 3 times, and then at the very right-hand side, there is a sticky tab. Once you close that sticky tab, it condenses that test and encloses it. you wait 15 minutes, and then you have your results. In the very beginning, I'm going to scoot back one slide so you can see this here. This is the control line. It is blue when you first get to this test. When you have the results, it's going to change from blue to red. 2 lines would represent a positive, and 1 line would represent a negative. Let me get my pen out here so you guys can follow along. Would represent a positive, and 1 line would represent a negative. Overall, the Nobility has the ability to leverage the test to be able to conduct for your students and your faculty and staff, and that's the test itself. What makes the test so powerful is the technology that can be linked with the test itself. So the idea behind Navica is for simplicity, availability, and security. Data is fully encrypted at all times. There are different functionalities within the Navica technology. We have the Navica app, the Navica Administrator app, we have the Navica Connect portal, and then the Verifier app. Each one of these particular 4 segments is to be able to associate cogs of a wheel of information being able to be shared back and forth, but yet also creates visibility for your schools to know who is positive and be able to send those test results out easily. The Administrator app allows the Nobility's health team to quickly be able to send results and also be able to store those results for testing and for reporting purposes. So managing your test sites. So once again, each individual school is going to have access to their own Connect portal. At this particular point, I'm just going to utilize Sophia as the example of overseeing the good health group or as a high school. And I'm going to use Dr. Kaufman as the person that's going to be overseeing or conducting the tests at those schools. So what's going to happen is Abbott is going to send over to Sophia her credentials to log on to the Connect Navica portal. At this particular moment of time, Sophia is going to set up the testing sites. At the very right-hand side over here, you'll see the test site creation box. You'll click into that, and then simply Sophia is going to be able to go in here and create those testing sites. If Sophia, the high school or the school administrator, wants to leverage Dr. Kaufman to be able to set up those sites, she can do so. How she's able to do that is by adding the team members. So here we can see a list of team members, but we can also create team members over here. So by creating that team member, Sophia is going to include Howard to be part of the team within the high school or the school. She's going to populate Dr. Kaufman's information here and then give permissions. So each individual within the school is going to be able to get access, as far as the administrators are going to be able to get access to the Navica Connect portal. The permissions are specifically aligned to allow certain users to have access to the Connect portal or to the Navica app itself. For instance, Dr. Kaufman is going to be wanting to get access to the Administrator app. He's going to be able to add, edit, or remove testing sites. And also going to be able to more or less look into the team members, as Dr. Kaufman is going to be leveraging his staff to be able to conduct the tests at those locations. Sophia at the school is going to be able to add participants and is also going to be able to view those test results. Dr. Kaufman is also going to want to be able to view those test results because of the testing procedures that Nobility Health is going to be leveraging and being able to send the results to the state, local and federal, as required by the FDA and CLIA licenses. At this particular point, that individual is going to be assigned to particular testing site locations. Once they check those boxes, the personnel is going to be able to go to that testing site and perform their duties or permissions as given. So the population monitoring with Navica. So I've already kind of addressed the story log here, but Sophia, she's going to receive her credentials and log in. So how is Sophia able to send the invites to the participants within that school? She has a couple of options. She can either export a CSV file, or she can specifically create an invitation to an individual participant, or she can upload a CSV file that your school already has on file. This may be your EMRs, or it could be your student profiles that you would already have a list. So you're able to download that template and you're going to be able to populate the first name, last name, and a reference ID. You can also subcategorize your patients within different school groups, such as sports. So if you want to have your volleyball team outlined to be specific a volleyball team, then you can group those patients or those students into different team members. Once you have that saved to your computer, you're going to select the file from your computer. You're going to open it and save it, and it's going to export those particular students into the Connect portal. At the very right-hand side, you'll see that the status is not invited, which means that we've created a list of individuals that we're going to send invitations to, but we have not invited them yet. You can invite those individual students at a individual basis utilizing this airplane mode, or you can send a whole list of invitations to a group of individuals by selecting the send invites. If you select the send invites, it's going to ask for you to confirm to send an invitation to all those participants. Once that invitation is sent, you now see that they are invited. You also have the ability to subcategorize or look or consolidate this list into different viewpoints. Right now, we're looking at the uninvited. If you want, or the invited list, if you want to reconfigure that to just your uninvited and send individual, you can. When the invitation is sent via email to that particular school or to the student or parents of the student, they will receive this email. It's very imperative that the school is able to notify about this Connect portal or this Connect code. This is going to link that student to that school. And so when they log on, they're going to utilize this Connect to link that student to that school. And so the results are there at that point shared amongst the two. So they're going to be able to follow those instructions. They'll receive that email and they're able to go to their application. Now, the Navica application is supported on both the Apple as well as the Android services. So this particular instance is a picture of an iPhone. And what they're going to do is they're going to create their profile. You also notice right here in the very middle, if you have students that are not have access to a cell phone, a parent can manage those students' profiles. You would be able to add or manage that particular profile, and you can add however many students or kids that the adult is overseeing. This is where that Connect code comes in play. They will be able to enter that code into here, and that's going to link that particular individual to the organization. And then you're going to click and confirm that we are going to be associated with that school. And then we're going to create that connection. So now GoodCorp sees that she is connected. On this next hand, the status symbol here, looking into the Navica Connect, Sophia is able to see which particular of her students are now connected to the Navica Connect portal. So now it's time for this particular, by this example, Jane, the student or the student athlete, is going to go and get tested so that they can play sports. Jane is going to log into her app and she's going to press continue. And you'll see that there's no active passes available for her, which means that she has not been tested as of yet. I'm going to kind of scroll down through here so you can see the different connections here as the different prompts at the bottom of the phone. If she were to look into the results, here she'll be able to see the results of her latest test. She's also going to be able to see a testing site. So this is also going to associate and assist that particular student as to where Dr. Kaufman is going to be conducting the testing for that school. This is a static QR code. So when she is going to Dr. Kaufman to get her test done, she is going to show Dr. Kaufman this QR code. This is a static QR code for those individuals that do not have a cell phone. If you wanted to print this off and create a Rolodex for those students, other sports entities is just needlessly stated that they would want to have this QR code printed out onto a piece of paper, and that's going to be able to link that test to that student. So just in case they don't want to have cell phones around to distract the athletes as they're about ready to go and perform, you can do that as well. Another K through 12 school did state that they are able to create a Rolodex and utilize this because their students were too young to have a cell phone. There's other ways of which you are able to utilize the static QR code to identify that particular student to the test. So now we're at the test administration. So she is actually, Jane is going to be at that testing site. Dr. Kaufman is going to sign on. Now, he's been given the permissions to conduct the testing. He's specifically going to utilize his credentials to sign in, and then he's going to select the testing site of which he's performing those tests, which once again links Dr. Kaufman with Nobility Health to you as a school because it's that particular site. At the very bottom here, you can see that we have begin test and enter test. So Dr. Kaufman is going to press the begin test, and he's going to scan that static QR code, and he's going to identify Jane as who she is, either utilizing a photo ID or the identification by the administrator or by the coach. I'm going to select continue, and then he's going to follow along with these roll-on questions, specifically for reporting. Going to ask the student a couple of questions, and then we're going to scan the actual test that's on the BinaxNOW card. Each and every one of these test cards have a different QR code. This specifically links this test to Jane, the student. The next particular portion is he's going to collect that specimen sample. Once he's able to conduct the test, the next he's going to place a 15-minute timer. Once that timer goes off, he's now able to enter results. So I just kind of want to pause right here. Dr. Kaufman has the ability to enter tests, link it to the student. He can do a large majority of these tests very relatively quickly, and then set a timer for those tests to go off. And then as soon as that timer goes off, he's now able to enter the results. He's going to once again scan that QR code, which links that test to that student. So there's no miscommunications from that perspective. And then he's at that particular point, he's going to look at the card and identify for himself, based off of the card, whether he is going to input into the system a positive or negative result. If it's negative, he's going to submit. If it's positive, he's going to submit. But in order to reduce errors from Dr. Kaufman's side, it is a double click to submit the information over to the student. I want to pause right here because many of these different schools have different standard operating procedures. As if a student was positive with COVID-19, the school wants to communicate that information over to the patient or student prior to them notifying that through the Navica app they came as positive. So at this particular moment of time, Dr. Kaufman can reach out over to Sophia and say, Jane tested positive for COVID-19. Please reach out to Jane and follow your own standard operating procedures that you have outlined as a school. And so that we're able to, at that point, once we know that you have contacted Jane to let her know that she was positive, then at that point, Dr. Kaufman can go back in here and press submit. So that's the administrator's role within the Navica portion. As you can see, it can be a very rapid process of being able to utilize the test and also be able to place those results into the Navica portion. So now Jane gets those results from Navica that was sent directly to her. She now has the ability to go back into her phone and be able to see her results. Now she goes over to the results tab and this will appear. If she is negative, you're able to see the date of when the test was completed, the lot number, and what type of test was conducted. If she is positive, once again on the right-hand side, she'll be able to see that it was positive, the lot number and the positive, and once again, when that date was actually performed. If she is negative, she is going to be able to create or have a QR code specifically tied to that test and when it was done. This particular example shows that the test was completed on Thursday and today is Saturday. She's able to show that to her coach, saying that I tested negative on Thursday, and today being Saturday, the day of the game, you're able to say, yes, I am negative, and this was the time that I was tested. As far as the Connect portal, so going back to Sophia being the operator of the school, she's now able to see the latest results. This particular slide is a little old, but at the very right-hand side, if Sophia wants to download and create a CSV file of the latest results, she can do so for her records. Because it's a CSV file, she's also now able to place that back into the student profiles of when they tested negative and what the results were of those tests. and they can reference that back to the student ID. So the pass verification. The pass verification is one of the last things I want to quickly speak about. It's the ability for an administrator or for a school, or let's say that you're conducting a sporting event and you want to be able to test your students or be able to look at their QR codes to ensure that they are actually negative. Remember that QR code of that negative result. It's not a static QR code. That's ever changing each and every day. So if a student is able to pull that particular piece of information up onto their phone, the verifier app is going to scan that QR code and it will actually show back that yes, that pass is valid and it is negative. The key thing about this QR code is it is not static. This QR code is ever going to change within the 7-day profile that you have set up. And so you'll actually see a different QR code. So those high school students that are trying to outgame or outsmart the system itself, if they take a screenshot of that QR code, the verifier app will recognize that it is not an actual QR code and it's a screenshot. And then at that point, the student will have to log on to see what those test results actually were. One of the items with managing profiles, I know I have a wide range of different schools here. There's high school level as well as other age groups. Specifically for those schools here, specifically for the underage population to where they do not have a cell phone, this is specifically towards the parents being able to create those profiles for their students. Once they're able to create those profiles, they're going to ask and answer some of those questions and their profile is created. I personally have created the 2 different profiles for my kids. It's very manageable. When you actually get back to the very beginning of this app right here, you're able to look into your managed profiles and be able to select. I have 2 kids, Noah and Annabelle. I'm able to select Noah and be able to look into his profile. So that's the last little bit that I wanted to cover with specifically the Navica Connect. I'm going into some of these slides I thought I hit, but I'm going to actually stop with my share here. I'm going to end my slideshow and I'm going to pass it back over to Sophia. I do understand that there'll be questions later on in the presentation. I'd be more than happy to answer any of those particular questions, but at this particular point, I'm going to pass it back over to Sophia as she can continue with her presentation.
Thank you, Cody. I'm just gonna get my slideshow back on. Okay. So just a few more kind of logistical details before we open up for questions. The way we do testing is completely customizable. We'll bring all of our own supplies to your site and set up wherever you need us to, without disrupting your usual workflows. So we can do a drive-through, which I'll go into more detail on. We can do it in an empty cafeteria, any indoor space that's not being used, pretty much anywhere. Our main priority is to have a seamless and efficient experience. And depending on the size of the organization that we're serving, we can do 50 to 500 tests per day per site. So it's very moldable to whatever the school or organization league's needs might be. One of the most important things here is that it's very streamlined. There's no heavy lifting up front. There's no lengthy registration process like Cody went over. It's very simple. It eliminates messy and time-consuming paperwork, and there's no administrative costs really associated. We don't have to have someone all day sanitizing clipboards and pens, which is such a privilege, because they won't exist in this case. Athletes or their parents, depending on their age, will be fully registered before they ever show up for their test. So this is just our drive-through model. It shows there's one person collecting tests and one person reading samples. It takes less than 5 minutes to perform the test and approximately 15 minutes to the result. Depending on how many people are being tested, we can have more people performing tests. Normally one person reading tests is sufficient, but as you can see, there isn't too much to it. It's very simple. And the same thing would go for a on-site setup. Just two separate tents, stations, desks, whatever it might be, with designated personnel, with dealing with people lining up, performing the tests, maybe like one monitor, making sure people are properly spaced, and then one person reading the tests. And then just the last thing I'd like to go over is that Nobility Health can perform testing without cost to the organization or to the athletes. No additional funding would be needed, and we would bill all of the athletes' insurance directly. Any uninsured athletes will be provided testing by way of the Health Resources and Services Administration per the CARES Act. So the government will take care of any uninsured athletes' testing costs. And we are also have always been committed to no balance billing. So there won't be any surprise bills, nothing will show up out of the blue. You get what we're stating here. So no surprises. And then I just wanted to go ahead and put up my contact information, my email address, a direct phone number. If anybody has any follow-up questions or would like to request a copy of the recording or anything like that, please feel free to reach out to me anytime. And I would like to now open it up for questions. Thank you everyone for your time and for listening to us, and we're happy to answer any questions you might have.
I'm going to jump in, if I may. Okay, so I'm just going to verify that this is all billed to the insurance, that insurance, you accept insurance reimbursement as 100% payment. There is no fee to the school. There is no fee to the faculty, staff, or student that's being tested.
Correct.
This sounds too good to be true.
No, we're like in shock.
Yes.
Because we have listened to so many things. Like I was thinking this is going to be so costly. Okay, Sophia, really?
Yeah. So yeah, because the Abbott test is so inexpensive to students, there isn't too much upfront cost. The Navica application comes with the test, so it's like a really cool gifted purchase. And the test kit only comes at $5. So we're able to put up the $5 per test and just accept whatever insurance pays out at that point.
Okay, so how do we sign up?
But yeah, that was my question, was how long does it take to arrange testing on site?
We can get it done as quickly as you need. I would say best case about a week. I'll let Cody answer how quickly we can get tests in. And that would pretty much dictate, if Cody gets the tests in and you get us a CSV with the email addresses, after that, our work is easy. We can be in a couple of days.
We typically ship overnight. And so once we receive that purchase order that Nobility Health is wanting to purchase a volume of tests, we receive that PO within the 24 to 48 hours. We are shipping overnight. So Nobility Health should have those tests to them in roughly 72 hours. I say roughly because we do not ship on Sunday, or sometimes we do not ship on Saturday. So typically if we receive that PO by Wednesday, Nobility Health should have tests in hand by Saturday.
And Sophia, you come and you administer the test. It would not be Kathy or me doing it, or the student or the employee.
Right. No, we would administer the test. We would read the test. All of that is our role.
I'm just
No brainer. Yeah, this is where have you been? Why did it take so long to find you? And my next question is, there was a lab that we talked to who originally was being reimbursed for student testing and now has come back and said that they are not being reimbursed by insurance for student testing. And so we need to verify before we sign up that our students are not going to receive a bill, that you are being reimbursed by insurance.
We are, yes. Nobility Health is able to bill the insurance for the tests, and Cody is able to ship us tests if they're being for school use, which it will be for school use. So.
And Sophia, I'm just so shocked. Like we're thinking, like at first I was thinking of our student athletes, but now we could extend this to our entire population, including faculty, staff, and all students, not just our student athletes.
Mm-hmm, mm-hmm.
Exactly.
And this is exactly what we talked about today with the health department.
Yeah, we did.
That is going to be one of the levels of protection that we need to put in place to bring back high schools.
Yep.
Okay.
Bada bing, bada boom.
Bada bing, bada
Yeah.
boom.
So, Sophia, could you stop sharing your screen so we can get the gallery view?
Oh, yeah.
Great, thanks. I do want to talk a bit about what happens in the setting of a positive result, because we are not the student or the athlete's physicians. So if they do have a positive result, there will be language as part of this that they either need to contact their school nurse or they need to contact their primary care physician. We're not going to manage a positive result.
Do you report it though to the health department?
Yes, we're obligated to do that. But in terms of quarantine recommendations, in terms of any medical care that is needed, this is equivalent to going to get a tube of blood drawn. And the lab director is not going to manage someone's anemia. They're going to send the results back to the physician or the advanced care practitioner to do that.
Dr. Kaufman, that's the part that we do. We do this part really well. We know how to take care of it from that point forward. So it's a perfect marriage there in that.
Yeah, I mean, when I saw this, again, having a daughter at Mayfield and involved in club volleyball, I just think it's a great opportunity to get kids back in school and back in athletics. And it's a great part of the solution to reopen and get the students back in.
Absolutely.
I do have a question about our district. Not everybody has health insurance. So some of our students do not have health insurance. And how do we go about testing those students?
Right, so that's where the HRSA comes in. Per the CARES Act, we are able to receive funding from the government for uninsured people. So we do have just a brief information we would get. It depends on the age of the student. Younger kids would probably be parent information, but just information about the student, and we're able to submit those claims and get them covered. So nobody will need to pay.
Yeah, the other thing that we need to work out, and I heard Sophia say, get us the CSV file. Obviously, you want your students' identities kept confidential. So we need to make sure this is all done through a way that cannot be hacked to the best security that's available, as well as HIPAA compliant. Even though there won't be any health-related data in that CSV, we're used to dealing with HIPAA issues for our surgery centers and other sites that we manage. So we will have that process so that we can assure as best as possible with encryption and everything else that we do for HIPAA protections that the data are secure.
Absolutely.
And then I understood, and correct me if I'm wrong, that with the results coming off of the app, it would come back to us in a CSV form, and then we could download that directly into the student's medical records. We don't have to manually enter it student by student.
So that's a great question, Kathy. And to answer that is no, you wouldn't necessarily need to utilize that student by student. You can utilize that CSV file, and then if your IT staff is able to create an HL7 from that CSV file that automatically feeds based off of that reference ID, that student identifier, it's automatically pushed into that. And once again, you as a school will have access to that Connect portal. So you will be able to download those latest results and be able to store that within yourself. Now, Nobility Health is also working with you as well. So what we want to ensure is the connectivity between you as a school and Nobility Health, and ensuring that you guys are working in collaboration with each other so that the test results are being sent to the student when they need to be sent to the student. Ultimately, Nobility Health wants to ensure the mental fortitude of each of your student athletes or your faculty staff. And so that's just one of those things where you as a school is going to be working with Nobility Health and ensuring that those results are shared at a timely manner and when they are to be shared. That CSV file is downloadable. to where at that point you can create and send those results, or you can just leverage that one-off cases if you have a student by student. But the CSV file does allow that fluid of transfer of information directly back into the student profile.
Does anybody have any more questions or anything to add?
We just reach out to you then, Sophia.
Please.
I'm going to speak for both of us, but we would go back to our administration and our COVID task force teams to present this, which I don't see where there would be any pushback there, and then potentially get this up and going as soon as possible.
Sounds great. Yes, just call me, email me, sophia@nobilityhealth.com, and we'll get this started.
Okay. And you said it takes about 5 minutes per test to administer a test through the drive-through. Was that the same time frame as for the walk-ups?
Yeah, it would be the same.
Okay. And then the student waits for the 15 minutes. The results would be ready in about 15, 20 minutes. Okay.
And then they could have that result if they were playing, if Mayfield was playing against Flintridge Sacred Heart, they'd be able to show their negative.
That's the most exciting part.
That's the part that's like, I can't wait to call coach. And
I'm just going to say,
yeah.
So they're going to have their green goes in the morning from that morning magnet screening app to show us, and then to go play in the afternoon, they're going to have the Nobility negative to go. Okay.
Exactly.
Right. And then the schools and the athletic departments will need to determine the frequency of testing that they feel comfortable with. You know, is this weekly? Is this less frequent, more frequent? Do you test before each tournament? And is it different if they're on a field versus in an indoor court?
So Dr.
Kaufman,
it'll matter by the level. Like if they are high contact sport, they have to be tested now. If it's football, rugby, water polo, and then it kind of moves down to being strongly encouraged or strongly recommended. And right now we're still in the outside. We can't be on the inside yet for our sports, but it's going to change rapidly, as you saw our numbers did today.
Right.
My understanding is it's 24 hours before a game. So if you're playing a game like water polo, football, it's 24 hours before the game starts.
You only need the results, and we had that clarified with the health department. The test doesn't need to be within 24 hours of the game. You just have to have the results within 24 hours of the game. Now, of course, you're not going to test a week ago and then use that, but that allows a little bit more leverage in for when you're testing. But one thing we talked about today with the health department is with bringing back high schools, because we can't do the stable cohorts or the small groups that the elementary grade levels can do. And so our groups are going to be larger, and there's going to be more mixing of the students, you know, all over, because of all the way high school schedules are, is that they are going to require not require, but strongly encourage more frequent testing, probably to the point of maybe twice a week in the beginning. And then depending on how it goes, then they may decrease that testing.
Right.
You know, let you know that that's what we were told this morning.
Yeah. In our experience doing testing, we went from about a 35% positivity rate. This isn't county numbers. This is just strictly our numbers. Down to as low as a 1% positivity rate day. So, you know, we are seeing progress, we are seeing the light, and we'd love to see it keep moving in that direction and bring that to campus. And I'm dying to go back to university. I know we're the lowest priority, but I'd love to walk across the stage for graduation. And I know that, you know, everybody else is in the same boat, so.
Yeah. And what we should make clear, and Cody, perhaps you can speak to this, but this is an antigen test. So it's close to the accuracy of PCR, but it's not the accuracy of PCR. You know, we're in the 90% plus range on sensitivity and higher on specificity. But doing PCRs, at least today, with any rapid resulting is not possible the way it is with the antigen test.
Correct. Do you offer PCR testing at all?
We will be.
March 17th.
Our start date is tentatively March 17th. We will definitely start. We will send an email to all of you as our contacts once we do offer that. But it's in the horizon, so it's coming up.
Okay, great. What turnaround time do you expect with that?
24 hours.
Oh,
Wow.
Until we reach a capacity where we can no longer promise 24 hours, we can promise 24 hours, up to 3,000 tests per day. So,
okay.
And doctor, they have said that we can do the PCR testing for the student athletes. I mean, they gave us the okay PCR versus antigen. So that that makes it really much nicer for them.
Great.
thank you, everyone. Thanks for being here and for the great questions. Again, contact me if anything else comes up. I'll share the recording, and anything else you need, I'm here.
Great. Thank you so much, Sophia. It was nice to meet you. Nice to meet you all.
Yeah.
Yeah, it's great to meet all of you. Thank
Yeah.
you.
Hi, everyone.
Pleasure. Thank you for having me.